The Health Department says 159,818 coronavirus vaccine doses were administered in the last 24-hour cycle, which takes the cumulative number of vaccine doses administered to more than 17,349,000. Now, of these, over 12 million people are now fully vaccinated here in South Africa. It has previously been said that in order to bring COVID-19 pandemic under control, 60 to 70% of the South African population needs to be vaccinated. This effectively translates to over 40 million people needing to be fully vaccinated and will require a combined effort of every sector of society. It is in this spirit that the DG Murray Trust and Tshikululu Social Investments have joined forces to establish the Vaccine Challenge Fund, which has already received over 13 million rand in funding to date. So to talk about this fund and how contributions have been made and can be made, we're joined by Graeme Wilkinson, who's a social investment specialist at Tshikululu Social Investments. Good to have you, Graeme. Thanks for joining us.
Good to be with you. Thanks so much, and good morning to all your viewers as well. Yeah.
So what is this fund all about? Talk to us about this Vaccine Challenge Fund.
Very much about helping to drive demand for vaccines, as they say from the Department of Health's perspective. They've got the supply. We now have vaccines. They're sitting waiting to be jabbed into people's arms. And now it's about how do we get people, South Africans, as you say, there are 12 million fully vaccinated, but there are another 48 million to go. How do we get people to the vaccines? And how do we get people vaccinated? And it's really about helping the Department of Health with this monumental national imperative. And yeah, we've got a long way to go, but we're getting there. This fund is all about helping to bring civil society and civil organizations and civil formations to help the Department of Health with this national challenge. And so we called it the Vaccine Challenge Fund. And we're really grateful to the 4 funders who've come on board so far. Of course, there's definitely scope and room for more to join. But what we're doing is providing funding for NGOs and community-based organizations to join the area-based teams that the Department of Health have set up right across all the districts right across the country to help in coordinating and mobilizing people to go and get vaccinated.
Yeah. So this is the reality is that, we've come to a point where, it's amazing how the conversation kept changing. So it was, we don't have the vaccines, and it was the battle to get the vaccines. Now we do have the vaccines. It's the battle to get the arms to get the vaccines into. And it seems to be leveling off, we're not blowing the lights out in terms of getting to that target that the president has set for us. So how are we educating? And I mean, how do you go about it as an organization to try and educate firstly, and to try and get people to actually be vaccinated? And there are many people who do not want to be vaccinated. So what do you do?
Yes, well, I guess one of the first things is trying to lead by example and making sure that we ourselves have got our vaccines. But that notwithstanding, it is very much about conversation. We're finding more and more that it's really just about having a real conversation with people. And through conversations, through relationships, we're able to help impart, improve knowledge. And for many people, they're just scared of the needle. It's not the best prospect to have to face a needle, but what's done. It's not something. Actually, it's not that we've never been vaccinated before. Almost all South Africans have already received vaccines as children. So it's about helping people realize that this it's not as scary as it seems, and that we are actually all better off having been vaccinated. And so the organizations that are being asked to apply for this vaccine challenge funding, we're not prescribing what it is that they need to do. In fact, what we're really quite excited by seeing in the applications we're receiving is that there is no one way to achieve this goal. There's so many different approaches, and of course, in different parts of the country, the realities are different. The distances in the Northern Cape are a monumental challenge to overcome. How do you get a person from one end of a very sparsely populated district to the other end where the vaccine is, for example? Those are the real challenges that the Northern Cape faces, whereas in a very densely populated urban area like in eThekwini, there are other matters and issues that need to be overcome to help people get to their vaccines. So we're really just looking for people to meet with people and to make things happen. Yeah. And that's what this Challenge Fund is really funding, is helping make those sorts of connections possible. But we're finding whether it's going door to door, and some of the organizations are looking to have field workers go door to door, explaining to communities, or getting onto their local community radio station and getting experts that are trusted to speak about the value of getting vaccinated. But there are just so many different approaches. But it really is about having real, authentic conversations with ourselves, with each other as South Africans.
Yeah, and like you say, different provinces, different areas, different. There is no same problem in the different areas of South Africa, and it has to be handled in very, very different ways. But and this is where we need to get out to the community leaders. I imagine you need to get out to religious leaders and into I suppose places where information that we keep on putting out there, and we can just pick up something and read it and get our own information and educate ourselves about it, and we're able to do that. But that is not a simple task for millions of people in the country and the access to the vaccine. So it's one thing to actually educate people, but what about the whole process of getting it out there? And we do know that the Johnson & Johnson vaccine is the one that is, I suppose, an easier one to get to people in remote areas, and yet there seems to be a bit of a problem. So perhaps you know more about that, and access to the Johnson & Johnson, getting it out there into the much more far rural areas.
Well, I won't profess to be a clinician or a medical doctor, but what this is all about is making sure that we work with doctors in each location, in each area, to help them face those sorts of challenges. There are definitely very strict clinical protocols around how to transport and prepare vaccines, and those have to be followed to be safe. But there's also a lot that needs to be done in terms of helping getting the vaccine into the arm, as you're saying. And whether it's Johnson & Johnson or Pfizer or any other vaccine that's been vetted and approved, it really is just about helping people appreciate the value of that vaccine. That it's a good thing, the right choice for them to do to go and be vaccinated.
So this is where the fund comes in. You're there really to assist, and that's where this funding helps. What about the also, I mean, we talk about the education, but there is so much fake news doing the rounds. And, again, information about this is needed desperately. And how do you assist with regards to this? Because this is a very, very big thing.
It's a huge thing. And we've seen even internationally that in different parts of the world, you can have vaccine hesitancy of as much as 26% of the population digging their heels in and saying, no, I don't want this vaccine. Be that as it may, and we obviously want to work to help those 26% appreciate the actual science and the I don't want to say the true facts, but yes, as opposed to fake news, but the truth around the vaccine and its efficacy. But also to work very hard to reach the others, the 75% who would be willing to get vaccinated. And it really is about, for us, we're finding it's really about just having real conversations with real people. Countering fake news can be quite difficult because it's, especially via social media, it can spread very quickly. And to counter that can be, it's a lot of work that needs to be done. And it's all of us as South Africans, particularly media, as well as those who are working in the clinical setting, like the medical, in the health sector, but also, and this is where the Vaccine Challenge Fund is coming from, also those community formations that are trusted in communities, your early childhood development centres, your health workers, your educators that are already in communities that have trust with those communities, empowering them to help bring the message of the truth of the importance of vaccine and how important it is for us all to be vaccinated. to people where it counts, on their doorsteps, in their community halls, in their churches and mosques. That's where we need to bring this real conversation. And through conversation, help drive the behaviour change we need to see.
I mean, it's certainly not something new that South Africans have been faced with. I mean, if we take our minds back to the HIV/AIDS and trying to get the message out there, and this is the same manner in which it was pushed out there. I mean, it was getting people tested and understanding that you need to know your status, and it was those trusted community members. It's very much so the same process, but this is quite different because it's actually putting something into your body that we're trying to convince people to do with perhaps not enough information, but I see where you're going with this. But let's talk about the money that's already been donated. So we're talking about 13 million rand. Who has been donating? I mean, is it mostly corporates, or do you find individuals also come forward and donate? Well, how does it actually work?
At the moment, we're very fortunate. Thank you for that question. There are two charitable organisations and two corporates, actually, at the moment. We've got the DG Murray Trust, and the Tshikululu Social Investments for ourselves. We've put some money into the pot as well. But we've been joined by the Discovery Fund, as well as Pottersell Manganese Education Trust, which is based up in the Northern Cape. They've also put some money in. And that's how we've been able to raise the 13 million. We do expect that for us to be able to get organisations in every sub-district in the country, we would need closer to 30 million to be able to achieve this goal. But we are running with what we've got, and the reality is, as we see from the stats, another 108 people died of COVID-19 in the last 24 hours. The more there's an urgent national emergency that requires us to move as quickly as possible. So with the money that's available, we are trying to reach as many organisations as we can, and grateful for this platform to be able to spread the word. Good. The reality for our current funding round is that we are closing a call for applications at 5 o'clock this afternoon. So we definitely would encourage organisations, civil society organisations, to look for our application form, complete it and submit by close of business today.
Fantastic. So just give us your details, how people can do that as we wrap up, just getting your information, applying for some of these funds, and also for making contributions.
Super. Yes. So I'm going to give our email address, or the website address for Tshikululu, which is tshikulu.org.za, or you could also visit DGMT's website, dgmt.co.za. And you'll find more information about the Vaccine Challenge Fund on those websites.
Fantastic. Graeme, good luck. Thanks so much for talking to us. We wish you the best of luck with us. So applications closing today at 5 o'clock. So hopefully this message gets out. And if you do need assistance, visit the website, see how you go about doing that. Graeme Wilkinson, social investment specialist at Tshikululu Social Investments, talking to us about the fund that already has managed to gather about 13 million rand for the distribution and just assisting with the whole vaccination drive in South Africa, and also adding to the education drive as well.